All right, everyone, it's about 1 o'clock, so we're going to go ahead and get started. Thanks again so much for joining us today. We appreciate everyone's participation on these calls. We've got a lot of good updates for you today. If you can hear us and see up there the agenda on your screen, could you please type yes in the chat box?
Everybody.
Awesome, thank you. So real quick, I'm going to go around the table here at the Coalition and just start out with introductions. My name is Scott Stevenson. I'm the Quality Initiatives Director.
I'm Marcy Easter. I'm the Business Information Director.
Good afternoon, everyone. I'm Sienna Mcfarland, the Infant, Toddler, and Inclusion Specialist.
Mary Brewster, Provider Relations.
Liliana Howard, I'm with Professional Development with Quality.
Laura Gartner, Provider Relations.
I'm Elizabeth Viola, the Chief Program Officer, and we do have on with us Roseanne remotely. Let's see if I can find her and unmute her. She wants to say hi. There's a lot of people on the call today. Roseanne, you're unmuted if you want to say hi to everybody.
Hello, everybody. Thank you so much for being on the call today. We do have a lot of good information, and as usual, we have a couple of needs of things that we need from you. So I'm looking forward to being a part of the call and hearing great things from our providers. Thank you.
All right. Thank you, Roseanne. And again, everyone, welcome. We do have a lot on our agenda today, so we're going to go ahead and jump right into it. We're going to start off with our provider news. Marcy's first on the agenda, but she's going to be joining us here in just a few minutes. So we'll go to the next item on the agenda, which is our ESS referrals.
Yes, hi everybody. I'm going to talk about this really quickly. I'm going to do my best to be Latricia today. She is now joining us today on this meeting, but she'll be back for our next one. Basically, with the BG1 ESS referrals, those are our first responder referrals, if you'll recall. Our staff has been working really hard to renew the referrals with the employers of those parents. And we've gotten quite a few calls asking if certain people have been extended. One of the things that you're going to find is that we're getting referrals back after the due date from employers. And because we're dealing with employers, the ability to, we kind of have to play within their rules. So we are honoring them if we get them back after the renewal date and there is no lapse in care. So for instance, we have a parent, I just talked to a provider this morning. The parent was renewed from October 2nd to January 2nd, and the provider hadn't seen the certificate yet. Well, there's a new certificate that the provider then had to go under and in ESS mod and accept that certificate so that that child showed up on their attendance roster again. So if you believe you're missing anybody that was supposed to renew October 1st, 2nd, 3rd, 5th, anytime in the beginning of October, I'm going to encourage you to go back and look at your eligibility under the school readiness. I believe you're checking, you're managing your school readiness eligibility, and you're going to be looking for those new certificates so that you can accept them. Now, once you accept the new certificate, you will you'll need to encourage the parent to log back in to their side of the family portal so that they can also accept the enrollment so that you can see the certificate again. I know that's a lot of information. Basically what Latricia told me to give you an update on was, and actually I'm just going to read to you really quickly. Her update for the BG1 ESS and how long this program will go on, this is what this is pertaining to. So it says, as long as the provisions of the executive order remain in effect, or OEL, the Office of Early Learning, determines an end date, first responders who have a valid referral on file will continue to receive services in 3-month increments. That's just like any other referral you have. So all referrals, they receive a year of eligibility, no matter what, But then every 3 months, we have to check and make sure they're still meeting those same requirements mandated in the referral. I don't see any questions that have come in for that, so I think we're either explaining it really well or really poorly, but let me keep reading for you. It is very important that the providers, that you all pay attention to the end dates on your payment certificates, which you have been, so kudos to you, because that's how we're getting all the questions from you. Well, so-and-so didn't renew, and so-and-so is telling me they renewed, but I don't see anything. So again, that's where you're gonna wanna just pay attention to the certificate end dates. Feel free to give us a call or shoot us an email to let us check on whether or not that eligibility came to be if we got the referral back from the employer. We are sending referrals out to employers 1 month before the end date. So some of those that went out, those that expired in October, we actually sent the referral or started sending the referrals to the employers back in September, in the first week of September. And in some cases, it's taking us almost 2 months to get them returned back from the HR departments of the employers of those parents. Let's see. Once the referral expires, the parents are notified and they have 3 additional months of service to reestablish a different purpose of care. So let me talk about what that means. So once this program is over and ending, if the parent does not receive another referral from us, or from the employer, I should say, then they will receive 3 months of eligibility so that they can reestablish a purpose of care. Now that is the same as our other referrals as well. So it's not just for the BG1 ESS. So they will have the opportunity to meet the requirements so that we can roll them over to a BG8 or an adequate billing group. After the 3 months of service are terminated and parents do not meet a purpose of care, then they would not be eligible to reapply for the first responder program. The program's ended for new applicants, so we're not adding anybody new anyway since July. So this is basically, we're starting to wind down this program, but we are renewing those referrals from those parents from October to January 2nd, typically. And I'm going to stop for a second. I'm going to look at the questions that we have. So the first question is, are we only supposed to look at certificates and not redetermination dates? So your certificate will show the redetermination date on it. So you should be looking at, you can look at both and they should match. Now for a referral, you're going to see an eligibility period of 1 year, but then we have to look at these parents' eligibility every 3 months because the referral for services is only good for 3 months for that billing group. I hope that one makes sense. The next question is, the delay in the process is confusing with the completion of ASQs and teaching strategies assessments. I would definitely agree with that. The thing is, if they've already been enrolled with you, you've probably already done your ASQ. You don't have to do another ASQ on them. If they are, so that piece hopefully is not as bad. Let me pause for a second. And Lily is going to speak on the TS Gold piece. Go ahead.
Okay, if you have any questions after my spiel, please contact me. There's only a few of you providers who are actually doing TS Gold, but basically, if you have a first responder student who was there during the assessment period, which was from August 1st and ended on October 1st, or excuse me, ended on October 31st, and they had to be there on site or at least to enroll for 60 days to be assessed, then they would qualify for TS Gold and can't be counted towards it because they are technically a school readiness student.
Okay, so hopefully that was that was understandable for you. We are going to be following up. Scott is going to be following up with an email, and he'll make sure that he gets with Lily to kind of put that in perspective as far as so you understand those dates, the due dates for TS Gold. For ASQs, hopefully, you know, we encourage you to do those within the first 30 days, even though you have 45 days. Just if you can get them done as quickly as possible. If you can't get them done, you need to please let us know so that we can try to assist you if possible. I realize that this is very confusing when talking about the BG1 referrals and the executive order from the governor. The current order goes through, I believe, November 7th, but I'm not 100% sure on that. And then we're going to be looking up the date for that. So far, it has not been extended that we know of, but we are watching it every single day. And of course, today being election day, I hope you all voted. Or some of you might be listening to this call from line, standing in line while waiting to vote. If so, hi everybody around you. You know, elections often sway things, so we'll see. We're definitely paying attention. If you hear something, please feel free to let us know. We'll do the best that we can and clarify this information for you so that you can read it down. And I'm going to go back to answer a couple more questions. One of them says, are you still pulling kids off the wait list? We are. We are actively pulling kids off the wait list. Marcy, you want to tell us something about that?
On Saturday, we pulled, I believe it was 97 children, which is approximately 50 families off the wait list. So we are continuing to whittle that down little bit by little bit, but we are continuously doing it, and we'll keep you informed with it.
Yes. So yes, the answer to that is yes, we are still pulling families off the wait list. The next question I have, so if on the portal, the redetermination date states one thing, we should get paid until the date listed, correct. It depends. The answer to that is it depends. So I would have to look at the individual circumstance of what's going on with that particular family. But in talking about redetermination dates, so the EFS portal, families they receive their eligibility period for a year, typically, and then they have redetermination dates based on the type of care they have. So if they have a referral, their redetermination date is going to end up being 3 months or less out from whenever they were determined eligible to begin with. If they are BG8, they're going to get an annual redetermination date. So meaning if they redetermined on November 3rd of last year, their eligibility renewal date would be today. 6 weeks ago, EFS Mod started sending those families that are due to be redetermined today reminders saying you need to send your paperwork in. So it started communicating with families 6 weeks ago. So families have 6 weeks to submit all their documents. And what that does is allows our team time to be able to look at the documentation, make sure it's what we can accept based on statute and rules, and then communicate back with the parent if we need to correct anything. And we have 6 weeks then before that eligibility period is up to get that done. Now, what I can tell you, which is really, really hard to deal with, parents are waiting until the eligibility date when to turn in anything. So they're waiting until today, their last day of service, to turn anything in. What happens when that happens is our staff are still taking it. They might be, their services might be up today. They're sending in their documentation at 10 o'clock tonight. Guess what? There's probably 2 people in the ELC office at 10 o'clock at night, and neither one of us know how to do redetermination. You wouldn't want us to if we did. So we're not supposed to be here. Our office is closed. We close at 5 o'clock. So when that happens, we still will accept the paperwork and we will still process it. However, if there is an error, which more often than not, there is an error, we give the parent 10 days to turn in their paperwork. So we will try to work with the parent even though they waited till the last minute to submit their paperwork. So for the provider that asked if you will get paid up until the day of determination, I would have to look and see the individual circumstance around that. Typically, I'd say yes. But I want to tell you that's not a blanket answer for everybody. So I would like to look further into it. and see what we can do. But hopefully we were able to answer your question about redetermination dates.
And what we can do, since everybody's having such a big question on dates and it comes to that, as you guys know, I've been working on some how-to guides, and I can add that to my list on how to understand or read certificates and redeterminations and enrollment dates. So maybe it will help future-wise to have that in writing.
Right. So it's really important that you all are paying attention to the dates on the certificate for redetermination, because those dates do drive when the parent is eligible for services. We do also understand it's been quite a hectic year and things have changed so rapidly, but we can look at your individual circumstances as we need to. And then the last question, I see what you're saying. A provider posted that they're being asked for updated ASQs every 3 months with the renewals. You don't have to do that. If you have a BG1 child that has stayed enrolled with you, you have an ages and stages questionnaire on file, you don't have to redo that every 3 months. It's annual. So it's the first time within the first 45 days of enrollment into the school readiness program, and then annually thereafter, even if they renew their services. So maybe you can breathe a little sigh of relief there to say, woo, you've been overdoing it, and congratulations on that. So some of those kids probably needed those 3-month interval ASQs, but you are an overachiever, and thank you for that. So you can relax. So it's within the first 45 days of enrolling into the school readiness program, and then annually thereafter, typically on the child's birthday or the renewal date if they're on that annual renewal. That's just an easy way to keep up with it. So let me pause. There's no other questions right now. So Marcy, you ready to do your part?
Yes, I can do my part. Bear with us. We're
swapping computers today, y'all.
Laptop. Got it. Okay. So I am going to start with this attachment you got from Scott the other day. Of course, we know today is November 3rd. You have until November 4th to submit your school readiness and Vpk attendance, as well as uploading those sign-in and out sheets. Those are extremely important. Please make sure you submit those sign-in and out sheets so we don't have to delay your attendance. This month, your reimbursement reminders was you got paid a total of 16 absences. Any absences past 16 must be marked as enrolled non-reimbursable days. Now you will see I have added this lovely select reasons. So you will see down at the bottom, it says enrolled non-reimbursable. So any children who are not attending your site over 16 days must be marked with that. Mark your first 3 absences as appropriate with the reason, and then mark from absent number 4 to 16 with absence due to disaster. This is the proper way to be submitting these. If you don't, there is a chance that we are going to end up rejecting these because we are limited sometimes on which codes that we can shift to non-reimbursable days. I don't want a delay in the processing of your attendance, okay? If you have any questions, please feel free to either put them up in the message or email the EFS mod team. Moving right along. At this time, we still do not need any documentation for absences. We will keep you updated every month as that comes about and changes are made.
And we have it in writing. We don't like to give you things that we just have hearsay on. I know that some of you are with other coalitions, and do remember everybody does things just a little bit differently. So if you are an out-of-county provider for Marion County, please make sure you check with your home county to make sure that we're not changing anything, or that they're not changing anything.
School agers. Anybody who has sent us a list of school agers that are attending your site and not going to brick and mortar or physical public school location, it is your responsibility to let us know if those children have re-enrolled back in school, so we can change those enrollments back to reflect that they're only part-time or vacation holidays and summers. We do pull reports. We do try to make sure all this data stays clean. And if you report it to us, this will avoid payment adjustments in the future, keeping us up to date with that communication. Highly important with that. I know no one likes to have money taken back out of their checks, so that would be very helpful. VPK, just as last month, we are back to the 80-20 rule, so nothing has pretty much changed on that. Please make sure you are submitting the sign-in and outs and the long and short forms as necessary. We are going to continue at this moment with having you contact Elizabeth on any closures that happens to your site. In the near future, we will be doing a training on you requesting those days through MOD. So you may see a new icon option tab in your attendance area. We're asking that you hold off on that until I do a actual complete training and get some how-to guides out for you.
But for now, we've just decided until we can get that training out to you and give you a better understanding of how to use it, just continue to send me your written closure statements. It's really few and far in between, knock on wood. Thank you all for being so diligent, because we've been very blessed in not having a lot of closures right now. While Marcy's taking a breath for a second, Rebecca, Pete, you have your hand raised. Did you want to say anything? Maybe it's down now.
Oh, I think she did it. Oh, no, she's still up.
Nope, your hand's up, Rebecca. If you want to say anything, just let us know. Or you can type it in the chat box.
I went ahead and unmuted her, so you are self-muted, Rebecca.
Okay.
Okay, and she took it down. No problem.
Way to practice those hand-raising skills, Rebecca.
Okay, last but not least, I did add on to the bottom of this is November's providers payment schedule. So you have that instead of having to wonder when you're getting paid for each of the items this month. I did confirm this with Sienna, and these are the dates that she did provide for this month. We are going to continue to update this reminder every month and get it out to you before attendance with any of the changes or any of the pieces that you would need to know with that. So that is one piece from me. The other piece is we have had quite a few calls lately on questions or how to do something on trainings that we have already completed in the last, I'd say, 3 or 4 months that we have done the how-to sheets and have emailed them to you. So I want to make sure that everybody knows where to access them if you've lost them in your emails or anything like that, and exactly what they are. So here is our website. On our website, you guys know you have a lovely little providers tab. And if you go down to provider resources and click on that, bear with me because I got to get things out of my way here. And then scroll down, you're going to come to an area that says provider how-to, quick tip sheet for providers. This also is kind of broken out, and we're going to start adding a little bit more based on the subject matter that quality brings out. So here, this first section is provider portal, EFS mod. So you guys kind of trying to make sure that what we call it, whether it's provider portal or EFS mod, you're kind of linking the two together, that they're the same thing. Well, on October 29th, OEL has updated their provider portal user guide. So you have complete access to how to do everything in the portal based on this guide. This guide is quite large, and it's right here. And we are talking 153 pages long. But it does have some great resources as well as table of contents to help manage to bring you exactly where you need to be.
And sometimes you can hit Control F on PDF and it'll bring up a little search box and you can put keywords that you're looking for and it'll take you right to those words in the document. Now it's very literal. So if you type in puppy, it's going to look for the word puppy. And if you're actually meaning something else, then it won't come up with anything related to it. So it's very literal, but it is a way to search through documents.
And then the next area is I'm trying to sort these by the tabs that are on your provider screen. So the first one is going to be your Enrollments tab. So here's a how-to to accept and reject enrollments. Well, accepting and rejecting enrollments are under your Enrollments tab. So that is kind of helping you organize a bit. The Attendance tab.
Actually, can we pause for a second?
Yes.
That is one of the major questions we're getting about those BG1 ESS referrals. Remember, when a referral is renewed, you do have to go and accept the enrollment again. So even though they've already been enrolled, if their termination date has come and gone before we got that updated referral, then you might have to go back. Even though there was no lapse in care, you're going to have to go back and you can use this form that Marcy's showing you on the screen right now to help walk you through the process of accepting that enrollment so that you can see those kids on your attendance roster again. So perfect.
And with every certificate that is out there, whether it's a redetermination, like Elizabeth said, one every 3 months for referrals, those have to be re-signed and accepted every single time. So the next one we have here is your Attendance tab. How do you flip a part-time to a full-time school-age child is your first one. How to guide to the reimbursement screen. Remember how you read the reimbursement screen, all the new features of being able to see why we rejected a child back is on that screen, and this one will show you how to read that screen. The other big one that we have had quite a bit in the finance department lately is how do I pull my reimbursement report? We definitely have this one right here. It's a very simple process, and it's not just how you pull it, but it's also how you read your reimbursement report. So these are tools that we are taking the time to have out there for you, and I want to make sure that everybody understands where to get them from. Also, your settings. This is not one that I think I've done an actual training on. It's been very, very simple one, but there have been instances where your name is spelled wrong or some information needs to be updated. And because the contract pulls some of this information as well, that is why you need to make sure your name is spelled right. It doesn't have your business name in this area, and has all your updated information. So this is highly important if you come to find out when you're signing contracts, some other name is showing up there. You may want to use this how-to. Now I know Quality has some other how-tos. Lily, she's doing a training today on a QPS how-to, so when she finishes, we will put that right here. So it will always be accessible to you. Any questions, comments?
No questions in the chat box.
No? Okay, thanks, Mercy. All right, we'll move on to the next item in our agenda. Here's where we like to just take a few moments to allow our partners who may be on the call with us today to provide us and the audience with any updates you might have. So we'll pause for just a few seconds here to see if anyone wants to raise their hand.
See.
DCF, no updates today. Thank you, Richard.
Thank you. We appreciate you being on the call.
Okay.
If there's anybody with their hand up real quick.
Sure.
Don't see anybody else. So, no, we're good.
Nothing now. Okay. Well, as always, if there's providers on the line, you think of something later in the call, if you'd like to give us an update, just raise your hand. We'll be glad to unmute you. So next on the agenda, we have our VPK updates. And first on that is teacher changes within your VPK application. And Mary is going to speak to that briefly.
Hey, everybody. Thank you for joining us today. I have spotted a small glitch in the VPK apps I just wanted to make you aware of. Whenever you go in and you add your new teacher and their documents, and then you go over to your VPK classes tab to, remove the old teacher and add the new teacher, kind of look above that where when you save your changes and it comes back out and you see your teachers down below, there's a line up above there that says class license capacity. Some of you will see a strange number on that line, and we're going to find out what's going on. We don't know yet. All classes should be, one teacher has a class size of 11, and 2 teachers has a class size of 20. And then when you're done, go over to your review tab and scroll all the way down to the bottom. This is very important, that you go down there to the bottom and look at your classroom, and it should be registering over to the side what your maximum class size is. As long as it's registering correctly down there on the review tab, go ahead and submit. And I think Marcy has something to add about this.
This is a known OEL issue. They are working on this. There are multiple tickets as well as for our coalition up there. So this is something, even if it does not match, they need to send you an email and let you know this is not matching, but still submit their changes.
Okay, and then still by checking that bottom of that review tab, that's your extra insurance that things are correct on your classroom. And that's it for teachers.
Okay. All right, thank you, Mary. Next is our 20 to 22 VPK progress monitoring pilot. So last call, Elizabeth did go over this with folks very briefly, but we just wanted to reiterate what the program is and how providers can apply. So again, for VPK providers, as you know, you do an assessment at the beginning of your school year and then again at the end of the school year. And then when your children graduate and they go into kindergarten, within 30 days of their first day, they are given another assessment. And that assessment is called the STAR Early Literacy Assessment by Flickers. So there's some inconsistency there, right? There's 2 different assessments being given to children. So what this pilot is, it provides an opportunity for private and public school VPK providers to implement this STAR Early Literacy Assessment, the Flickers assessment, with children in their VPK school program year. So for this year, for those folks who want to apply and are eligible to do this, they would be administering this first Flickers assessment during their mid-period, which falls around January, and then again at the end of the year. And then starting the next year, the 21-22 school year, they would be administering this Flickers for all 3 periods. So in the beginning, the middle, and the end. So it is a voluntary pilot. It's not mandatory. You're not required to do this. But on the paperwork that I attached, you will find a link to Bright Beginnings, and that is the link to go to apply for this.
And you'll see it, if I can jump in real quick, you'll see it on the, we weren't able to attach it to this because we had so many handouts today, but I know it got sent out last time and it was sent out earlier with Scott's update email that went out. So you'll just want to look for that, but when you log into Bright Beginnings, the option to apply will be right there. There is a deadline though, so you'll want to go ahead and apply now. And there is about 1,900, I think, spots for this pilot project for the whole state. So you do have to not have any Class 1 violations over the past 2 years in order to qualify. So that is one of the qualifying factors. So if you would like to apply though, go ahead and apply. The coalition is going to be assisting OEL in making sure people are eligible.
Yeah. Yeah, and as Elizabeth stated, you can't have any Class 1 violations in the last 2 years. You have to have a full VPK school year program spanning the length of the school year. So it wouldn't apply to those who have the condensed program from January to May. And providers who are on probation, you are eligible and you are able to apply for this as well. Elizabeth mentioned a deadline. The deadline to apply is next Wednesday, November the 11th. Do you have any questions on that?
No questions on that. Our handy dandy CEO is behind the scenes and did some research for us. So she was able to find that the executive order actually goes through today. So we'll be looking to see what Governor DeSantis decides to do with the Florida executive order concerning COVID-19. So it will expire tonight, probably midnight. And then we'll have to see what happens with that. So thank you, Roseanne. I'm going to keep going on the agenda on VPK attendance. As you all know, VPK attendance, overall attendance, public school attendance is at least a third lower this year than it was last year. So the coalition is working on a few different avenues to try to increase enrollment and to try to really get parents to understand that it is safe to bring their kids back to your site for VPK, back to the schools, to brick and mortar. We want to get back to life as typically as we possibly can while still living safely within this pandemic. So the coalition, I know you guys already know this because we talked about this, but every time Family Times magazine is published, we are in Family Times, usually multiple times. But the coalition has a dedicated article series that goes into each publication. Sorry, I couldn't think of what I wanted to say. This next one coming up, the publication that will be published for December and January, we are going to talk about safely returning to school and preschool and VPK. So we are asking for your help. What I would like to ask you to do is in the chat box, there's a chat box at the bottom and there's a questions box. You can use either one, but in the chat box, if you will write a sentence or two about what your school is doing to keep students safe and healthy during COVID, and why should a parent bring their child to your school, and how are you going to keep them safe? How are you doing that now? The other thing I'd like to know is what are you currently doing to recruit families to your VPK program? So the coalition, let me tell you what we're doing, and then I'm going to pause for a second and look for questions, but I'd also like to unmute everybody and ask you to tell us, or raise your hand, and we'll unmute you, and we'll ask you, tell us what you're doing to advertise your VPK program, because we can do a lot from our level up here, over here at the coalition, but you have a lot of power in your hands with the parents that are coming to your site and their siblings, and what communications are you putting out there. So we would like to know what you're doing to advertise your program as well. So the coalition, we have a couple of billboards up. We're doing this article to try to encourage parents to take their kids back to brick and mortar, meaning back to your VPK site, to your child care facilities. We are trying to support you as much as we can financially with curriculum reimbursement so that you have the most up-to-date curriculum using in your school. We are talking at every meeting. I can tell you I've been with Roseanne to multiple community meetings where we're spreading the word that enrollment is down and we need to find these families. So we are encouraging our community partners to spread the word about VPK, not just VPK, but all of our educational programs, but especially VPK. We are reaching out to sites that we know have 4-year-olds enrolled but are not VPK programs and asking if they would like to come back aboard. And if they've never been aboard with us as a VPK provider, we would like to assist them in providing different technical assistance so that they can become a VPK provider and kind of troubleshoot to see what's happening. Let's see. So let me pause for a second. I have one question and I see somebody with their hand raised, so we'll get to you in just a second, Ms. Francine. Hold on, hold tight. The question we have is, when you say 2 years, can we get a from and a to date? I'm going to say I need some more info on that. So if the provider who wrote that can please expand upon your question, we can answer that question for you.
When I hear 2 years, I'm wondering if she was referring to what I was.
Oh, okay. So maybe, yeah. So 2 years would be from the date you apply. So if you're applying today, it would have been 2 years ago, so November 3rd, 2018. If you had a Class 1 violation between November 3rd, 2018 and November 3rd, 2020, she said thank you because you read her mind. Yeah. Way to go. That rarely happens around here. So yeah, I would use the date that you're applying. So what I would tell you is if that 2 years falls off tomorrow, apply tomorrow. So that you're not, disqualified for that. So I have Ms. Francine, you have your hand raised. So I am unmuting you. And you have self-muted, so you can go ahead and unmute yourself and ask your questions or share how you're advertising your program. I can almost feel it. She's trying to unmute herself. So give her just a couple more seconds. Okay, so Ms. Francine, if you can figure it out, just holler out. I'm going to keep you unmuted. Anybody else that would like to share? I'm looking to see. I know I've heard from a few of you that are saying, I don't have to advertise my program because we're full. So if you're full, and I know that some of you that do have full programs, I would encourage you not to keep a wait list, but to make a friend in the community, or, reach out to another provider that may be close to you or offer a program very similar to yours. Oh, Francine, is that you?
Finally. Hello, everybody.
Hi. Welcome. What's going on?
But as far as the VPK, I have cards. I've been going out to the grocery store, to everywhere that I go. I've tried to do it on the parent, Ocala parent page. I'm not that too much into the media thing, but I go out and word them out. I actually have 2 kids here that I have their paperwork, and I don't like to hold it when somebody else can benefit from it. But the good thing about that, I teach, and I get them prepared for going into the regular school. But if somebody else needs children, the parents don't want to take them out, but I have openings galore. And I'm a good provider. I actually kind of help the parents too with them helping with the VPK. I still do the assessment and everything that I'm supposed to do, regardless to getting paid or not. But there is a lot of providers out there that have a waiting list, and if you have a waiting list and someone needs it, I'm open for VPKs. So if we would just share, but I know it depends on the parents. So I'm open for whatever, and I love teaching the VPK. So please put me out there. I'm putting myself out there by word of mouth and with my flyers and my cards. So that's it.
I love that you're using cards. Business cards can be really effective and can be easy to distribute. doctors give us all of our follow-up appointments now on little business cards that have it written down, and they're easy to put in your sun visor. They're easy to put in different places where you can see them. I know some providers have gotten magnets made. They're not super expensive to have a few bulk items made. So it could be a well worth it investment. The other piece too, when Ms. Francine just mentioned social media, we get that a lot. We are on there a lot. We're monitoring social media, especially Facebook groups. There's a lot of parenting groups for Marion County and surrounding counties. And oftentimes parents will go there because word of mouth is so powerful. It is so powerful. And I don't just mean the Facebook group word of mouth. I mean the whole piece of just, you know, asking parents for their opinion on their favorite child care facility. That is a big deal. So getting your word out there, finding out where you can advertise. If it could be, I don't know the cost of getting a little banner to run across Facebook every now and then, but it might be a well worth it investment because we are in a very different time right now. I do have one piece of feedback from providers that says, I'm not VPK, but I advertise my center by creating a Facebook page, Mrs. Cora's Family Daycare Home, like us on Facebook. And you've heard that from the coalition. Last year, we were on a big bandwagon about like the coalition, like us, like us. We had a goal. We wanted at least 1,000 likes on Facebook, and we surpassed that. We jumped past that line. So that's a great idea. So Marion County Public Schools, I'm just going to read what Vicki shared. Vicki Nevels is our contact for VPK with the Marion County Public Schools. Thank you for being online, Vicki. I'm going to, as soon as I get back to my question box that I just closed inadvertently, read what Vicki said. So Vicki said, Marion County Public Schools created 4 health and safety videos that cover the areas of face covering, social distancing, respiratory etiquette, and hand washing. We use a very young 5-year-old and followed the CDC recommendations for the topic, so they have a 5-year-old starring in their videos. Our pre-K and kindergarten teachers viewed the videos and showed it to all of their students. And Vicki's going to forward these out so that we can send you links to them too. We can look at them from the coalition side and the provider side. And to keep students safe, they've limited their toys to those that are easy to clean and to limit the number of toys used. I know some other providers are doing that as well. Oh, that's another provider. So Triumph and Tots, you added yours. You're limiting toys so that you can clean them easier. And it allows you to have the children split into smaller groups, clean each toy. These are fantastic. So we're gonna use that as we're writing our article, and we're definitely gonna give you credit. So if you want to be a part of our article in Family Times, please send us a little blurb. You can put it in the chat box like the other providers did, or you can shoot me an email. The other thing we're doing this week, the quality team is going to be reaching out to those of you that have decided to offer your January 1st class, because we want to encourage families to get enrolled. We want to increase your enrollment in VPK. That is the bottom line. The other thing we're planning is a VPK roundup. I'm not sure where that's going to be yet, but we are planning a VPK roundup. The quality staff just got a really big eye at me. We are planning that. It is going to happen swiftly. It is going to be socially distanced, face covering, very safe, to encourage the enrollment of VPK students in those January classes. Those are a lot of things that we're doing. So again, I'm going to encourage you, reach out to us, let us know what you're doing to advertise. We are going to continue to advertise. Our goal is to increase enrollment in VPK and increase enrollment at your sites to help you stay open, and to really let parents know that you're going above and beyond to keep all of the children safe that are in your facilities. So thank you to those that shared already, and I think that's it for that particular part.
Okay, so next on our agenda, we have our own inclusion specialist, Sienna Mcfarland. She's our infant, toddler, and inclusion specialist, and she's going to talk to you a little bit about some positive discipline techniques.
Hi, good afternoon, everyone. Thank you for joining us. Just to remind you that I am the new infant toddler contact person here, as Mary is no longer here. So any questions you have concerning ASQs, you can contact me directly. One of the other things I'd like to share is that I have been going out to do child observations. So if you have children with behavior issues, I want to ask you to contact me first. I will come out and do an observation of the child or children. We have the Help Me Grow coordinator, Tanya, who will work with the parent. We do not want you to wait until you have gotten frustrated, until the situation escalates, and you have already made a decision before you contact us. Just allow us to intervene and just contact us first. So what I want to share with you today, I think you'll be getting just a little flyer that I created with the benefits of positive discipline. So I'm not going to read through that part. I want to share with you some strategies. And especially if you have, new teachers who do not have the experience with dealing with children, and we know that it is very challenging. Even for those of us with experience, know that we can sometimes have kids that are very, very challenging. The one thing I would say and share, though, is that when kids misbehave, it is due to a need not met. And so what we want to do is to find out what is that need. We want to be compassionate. We want to be kind. These are children, to me, who are just learning what it means to be human. They're trying to learn what is acceptable and what is not. And we have to take the time to teach them the skills. We can't expect that they're going to come knowing all of these skills. So we have to take the time. So one thing I'd like to share is to set limits, and just to be practical, if you have a child who is writing on the wall, for example, with a crayon, we set limits. We tell them what is acceptable. We tell them what the crayons are for. And we tell them if you do that again, then we might have to take it from you. And we're not going to snatch it, because I know sometimes our emotions get in the way, just at us seeing what they are doing. But they are learning from us. And if we want them to be kind, if we want them to be patient, we have to demonstrate and we have to exhibit those behaviors. The other thing is to offer choices. This technique helps to avoid power struggle. So we can ask them, do you want the big truck or the small one, right? Especially if it is a case where they are struggling with another child for a toy that they already have, we can distract them and offer them something else, and just let them know as soon as Tom or Adrian is finished playing with this toy, you will be able to get it, all right? The other thing is to create a yes environment. And when I did this research and saw this, I thought it was so true. People, including adults and children, we don't like to be controlled. We don't like people telling us what we can't or cannot do. And I just thought back to my own childhood, the very same thing that your parents would tell you, don't touch, don't open. It made you so curious you wanted to do it. And it's the same thing with these children. So we want to reframe what we say to them. So instead of saying no running in the hallway, and I know some of you are doing these things, we use our running feet. No hitting. We tell them we do not hurt our friends. We just try to find different ways to reframe the things that we are saying. And one of the most important things I find is staying consistent. We can't say something today and change it tomorrow. They're not going to believe us. And depending on the age of the child, they're going to think we're liars. Because yesterday you said something and today you change it. So we want to be consistent with them, and we're just trying to help them and giving them the skills that they need. And, try not to shame them. Sometimes we don't know what is going through their head. We don't know what's going through their mind. We don't know the experiences that they are coming to us with. And so we just want to ensure that we take the time to teach them these social skills. And I have also attached at the end the article where I got it from, and it has tons and tons and tons of ideas that we can implement with our children. And my quote for today, it says, "You can't teach children to behave better by making them feel worse. When children feel better, they behave better." And so I just want to encourage you to try with them, be patient, be kind, because they are learning from us. And that's my little bit. Thank you.
All right. Thank you, Sienna. Yeah. Thanks so much. So if you're one of those providers and you've got a child in one of your classrooms who's exhibiting challenging behaviors, please give us a call. Call Sienna. Let her come out and share some of these skills that she has that she can help you so we can keep these children in the classroom with their peers. Next on our agenda, we have professional development. And I'm going to turn that one over to Lily, and she's just going to go over some upcoming opportunities and some QPS updates.
Okay, so as you guys may be aware, we have Time to Sign is coming up on the 14th, and you have your CPR as well. Also, there's only 4 spots left, but we have infant toddler MMCI class group coaching available. Speaking of learning new ways to help your behavioral issues in your classroom, this is a great opportunity for those who want to make this commitment. It is 11 sessions. The first one is this Saturday from 9 to 1. And the following sessions are on Thursdays from 6:30 to 9. I do have limited vouchers for substitutes if you need a substitute to cover a teacher in order to make it to class on time. Please feel free to contact me if you have any questions. And with QPS, Quality Performance System, there have been some recent updates, one of which you'll see these exclamation marks next to your staff's name when you log in. And I did a visual for you so you can see, so you can see what you should be seeing when you go in. When we do a registration and prepare you for registration for class observations, you'll need to update your staff educational information, and you'll click on the pencil and edit the staff information by scrolling down and using the drop-down arrow in order to select the amount of education they've had, whether it's a GED, high school diploma, or degree. It's just a click of the options. And if you scroll down, you'll see the options. If you don't have any options to select, if none of that applies to your staff, you can click NA. And then when you're done, you'll submit your roster. Submit your roster is an option that you'll see below your staff roster names. And you can, we prefer that you submit it every single time we go through registration, and it would be helpful if you submit it anytime you change your staff information.
Are we done? Okay. Looking at for questions real quick, because we are at our mark. Let's see here. Thank you, Lily. You must have done a fantastic job. They don't have any.
Either that, it was just too quick and too dirty.
There are, so Time to Sign, we do have a few openings left. That's on November 14th. All of these you can go to our website to sign up for. I'm trying to think what else do we have going on. Your incentives, those of you that attended the Ranch Wally series, we're still working on getting your incentives together. We did have quite a few of the same people attend from the same site, so we want to send you one box with everybody's incentives. That takes a little logistic planning on our staff's part, so our staff has done really well with pulling it all together. So those items will be ordered and sent to you. And what else do we ask? Go ahead, Scott.
I just have one other thing. At the beginning of the meeting, when we did introductions, you may have heard a new name that you've never heard before. As Sienna stated, of course, VidMary is no longer with us, so Sienna's in her position as our inclusion specialist. And Javora Gardner, who's here with us now, she took Sienna's old position at our provider relations spot in the quality department. So we have another addition to our already existing awesome quality team. For you providers out there who were used to Sienna and Mary kind of splitting up the alphabet, Javora will be taking on the A's through the I's, and Mary is going to still continue to do the J through the Z's. So again, I just wanted you to hear that name again and to get familiarized with it. Javora Gardner, she's our provider relations specialist in quality, and you'll be hearing from her shortly. Have any other questions?
Not that I can see. So with that, we will say good afternoon, everybody. Have a great one. Bye. Bye.
Bye-bye.